Since the onset of the COVID pandemic in 2020, healthcare has faced many workforce challenges in delivering patient care, including staffing shortages and clinician burnout in the face of unrelenting demand. These challenges have affected all healthcare staff, from frontline workers to the C-suite. Having the right leaders in the right positions is essential to building and strengthening a dedicated workforce, as well as preparing for the expected and unexpected business continuity challenges before, during, and after a crisis. This is especially true for the healthcare field as it continues to battle the unprecedented COVID pandemic and faces what comes next. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. Join us as Northwell Health shares how its leadership approaches have affected all levels of clinical, operational, and administrative staff to help the system weather the storms of the COVID pandemic, the Great Resignation, and more, all while providing the highest quality patient outcomes. The conversation will also touch upon the concept of destination employer and how it supports the hospital's culture. Today's podcast is brought to you by the Hebets Company.
Hello, I'm Sue Ellen Wagner, Vice President of Trustee Engagement and Strategy at the American Hospital Association. Joining me today are Jean Tangney, Senior Vice President, Chief Business Continuity and Crisis Management Officer with Northwell Health, Jim Hebets, President with the Hebets Company, and Jamie Hebets, Senior Vice President with the Hebets Company. During a crisis like the current COVID pandemic, great leaders enable an organization to maintain its culture, values, and traditions, but still evolve into the future with fresh thinking and ideas, all while delivering the highest quality patient care outcomes. One key question is, how can leaders prepare for and manage the almost unimaginable scenarios facing hospitals during the onset of and throughout the course of a crisis like the COVID pandemic? Let me start with asking you, Jean, in your experience, what makes a great leader and how do they apply these leadership skills, especially during a crisis?
Well, Sue Ellen, thank you, and thank the American Hospital Association for hosting today's discussion. And it's really an honor to be here with Jim, and they're a great partner of our system. So I look forward to this discussion. When we take a look at the attributes of a leader, especially a leader that is dealing with crisis or dealing in a situation that requires a high stress level, what comes to mind for me is about four attributes that I look at, and I've seen successful leaders manage quite often. Number one, being a great communicator. You need to drive a message very in a clear and decisive way. And then I think most importantly, to tailor that message to the challenge that you have so that all different levels of the organization, the community, and the other components of the cabinet are all working through, but they have a commonality of language, a commonality of description, a goal and objective is clearly defined, and a sense of confidence in that as well. And then the second part to that is visibility, being a communicator with high visibility. When I take a look at our experience through COVID-19, our CEO, Michael Dowling, to the crisis managers' stress level to make it even higher, decided to be very visible during COVID-19, to walk the halls, to go into the ICUs, we managed the Jacob Javits Center with the US Army, to be on the floor, frontline, arm in arm with our associates working in the units. That showed leadership. The team rose to that. They saw the highest levels of leadership arm in arm with them in some of the most stressful times, and that was incredible. The second, I think, is really important is humility. It's not about you. It's about the situation. It's about the organization. It's about the mission. It can't be about you. Confidence without arrogance is key here, and it's really about the mission and how you represent that. The third, and the one that is always most difficult that I see leadership deal with, is just be decisive. Quite often, during a crisis situation, the details coming in are often challenged and lack maturity. We in healthcare like to have a lot of committees. We have committees for everything, as you know, in healthcare. We're a committee-based organization. We want to choose a carpet color, we have a committee, right? But in a crisis, we don't have that option. We have to make quick decisions with a little bit of information. Don't fall victim to analysis paralysis. Make a decision, stick with it. The majority of the time, that decision is going to work out very well. And the last one, and I think the one that's most important, the one I think our organization's most proud of, is integrity. Michael Dowling, our CEO, was quoted by saying, "The only way to serve yourself is to serve others." So if you remember the decisions that you're making in the times of highest stress and the times of highest impact, and if you remember those decisions and you're making them with the best intentions of your community, your patients, and your employees, the majority of the time you're going to make good decisions and you're going to make the right decision. So I would say those are the four that I look at quite often are very reflective of a successful leader during times of stress.
Hey, Gene, this is Jim Hevitz. I might add a couple of observations that I've had a chance to watch firsthand over the last several years. Gene, I know you're already exemplifying the humility trait, but you were already seen as an extraordinary leader. You were already visually observed and respected because of the role you'd been playing for many years before. So I think one of the things that I watched is you stepped into the arena already as a pre-chosen person that everybody felt confident in, comfortable with, inspired by. And I think that led to the others working so well. Do you have a comment about that? I know it's hard when you're talking about remaining humble, but it's okay. I'd love to hear, because I think in the absence of their familiarity and respect for you, maybe somebody other than you in that job might have been visually seen differently.
No, and I appreciate that, Jim. Thank you. Your comments are, again, being humble. It's hard to acknowledge that, but I look more about experience in the seat. And when you're in the seat, and I played the role of the deputy incident commander to our chief operating officer. Remember, we don't put our CEO into the top seat. That's not his job in a disaster. So it was very humbling, and we often interchange that role. You have to know your organization. So I think when I look at the job that I'm currently in now, prior to this, I was chief administrative officer and held several other C-suite positions. That was a development tool for where I am now. So I think when you're dealing with large crisis where all parts of the organization, now think about COVID-19. COVID-19 affected everything that we did. It wasn't a hurricane. It wasn't a power outage. It wasn't a terrorism attack. It wasn't an Ebola type of situation. This was a situation that impacted our workforce, our communities, the physical delivery of care. The acuity of care was through the roof. It really was an emergency of emergencies. And when you're sitting in the seats and you're having to be the navigator of deployment of personnel and key choices, you have to have a good awareness of the organization, a history with the organization, and understanding how the organization works. I would say that helped me greatly when I was sitting in the seat in some of the most difficult decisions that had to be made. You have to know what the impact is going to be, and you're going to have to know what the outcome is going to be, and you're going to have to make the decision. Going back to decisiveness, Jim.
Leadership is crucial in establishing the culture, values, and traditions of an organization, especially in a time of crisis. At Northwell, how are you actually doing this? Reinforcing the importance of keeping your leadership together. How is that affecting your workforce, resiliency, burnout, and employee satisfaction, and maintaining staff levels for patient care?
Well, Sue Ellen, I think it's a great question. I think everyone is suffering from this COVID pandemic fatigue. From going to the food store to your local gas station, you're seeing it in our communities. People are tired, and we're no different. Hospitals are a reflection of our communities, and we live in our communities. We shop in the same stores. We deal with the same issues that the community deals with. But COVID-19 was the longest and most impactful crisis our organization has ever seen. And our culture really started back when our CEO and the current leadership team took over Northwell almost 30 years ago. And there were several foundational elements that we wanted to focus in on as an organization. And thankfully, preparedness was something that was one of the core foundational elements of the system. And even in 1999 and 2000, we had CEO forums in New York where Michael invited several other CEOs of other health systems to come and talk about the possibility of terrorism. This was before 9/11. We had the FBI in, and we talked about this, really unheard of at the time, and almost given us an alarmist type of brand. But that, unfortunately, over the last 30 years, the organization has been comfortable with being uncomfortable. Where we are, where we deliver our healthcare is in New York City and in the surrounding suburbs. We're used to disasters. We're used to terrorism attacks, Ebola, SARS, 9/11, Superstorm Sandy. These were all really, really big issues. And our leadership team, and we're blessed, I have to say, we have a very low turnover in our executive leadership. We have long tenure in our executive leadership, or quite often that is highlighted when we have our third-party reviews of our system. And we attract strong individuals who believe in public service. And it's really a team environment where the focus is on influence rather than title. And I would say that is the core ingredient, and that is the best ingredient to have when you're in a major disaster. And then we try to tailor that, talking a little bit about that, we try to tailor that with career development and benefits packages that maintain that commitment in a two-way street. So it's the idea of looking at Northwell, and I'm going to actually talk about this more and later, but not as a job, but as a career. And then tailoring benefits and tailoring organizational structure and career development to that career where we want you to join our organization. You're going to be interviewed to make sure you have the values and the skills, but we ultimately want you to have a career with the health system and to have an aligned benefits and organizational structure that makes you successful and makes you want to stay for those 25, 30 years. I've been blessed to be with the organization for 25 years, and I couldn't think of working anywhere else. It's just a fantastic place. And the other part of that was we have a strong continuity and leadership plan where we're all interchangeable. And COVID really showed that. We had our members of our team get sick right in front of our eyes, several of them in critical condition, and we had to take their roles and morph into their roles on top of what we were doing. And more importantly, our CEO empowers us, our board empowers us. They empower us to make decisions, they empower us to lead and innovate. And I would say one of the core tenets of our organization is innovation and empowerment. And then lastly, just talking about the fatigue question that you talked about, which is so real going on right now in so many organizations. Our frontline workers have been in the frontline for 2 years dealing with this virus, and most likely just coming out of Omicron, and questioning every time they go to work, am I going to get sick? Every time they have a cough, just like you and I, am I sick? Am I going to be able to take care of my patients, go home, see my family? But the biggest thing that I think we see out of this, we see a new compact coming out of this with our associates and with our team. It's a great opportunity to double down on our efforts with our frontline staff in a new compact. And I would say that we're focused on a couple of areas on being better listeners. We need to listen to our individuals, our associates, our team members, our communities. And I'll talk a little bit about that later, is the open opportunity now to engage communities like we never have before, because we were thrust into public health like no other time we've ever had in our careers. The opportunity to have Northwell be chosen as a career place, not as a job. And I think those are the unique characteristics that we're trying to work through. And again, an associated tremendous amount of other types of organizational commitments to around wellness and growth, and we'll talk about those later. But I do want to talk, not to give, but some of this is all documented. Michael Dowling wrote a book about our first wave experience. It's called Leading Through the Pandemic. It was published in 2020. You can get it at any other. I get no benefit for that. Just want to make sure everybody understands that. But it does document the journey and lessons from the first wave.
So, a couple of quick thoughts or observations, Gene, I'd love to just have you speak to. I've been doing this for a little over 52 years. We have more than 70 healthcare organizations around the country we serve. Without any doubt, you guys have had the most extraordinary journey of attracting and retaining the very finest talent in the profession today, and no one leaves, to the point you were making a minute ago. So as I was watching what happened and how you addressed the issues, many of your executive leaders have spouses also working for Northwell in other capacities. One that you and I are both friends with, his wife was a critical care nurse, and he didn't get to see her for more than 3 months of time while she was in lockdown during this. So it didn't just affect the challenges in a regular individual's life all by themselves as though they were in a vacuum. It had family challenges that were beyond anything we might imagine. Speak to that a little bit, would you?
When I think about that, I get emotional because I think about those first couple of weeks. We're a big military supporter. We're one of the top military employers. We have a huge military and veterans program. And we've been doing that for 11 years. It's a lot of action in that program, but we got to see a lot of post traumatic stress syndrome. We got to see what deployment, being away from your family, looks like firsthand. So we dealt with a lot of behavioral health in the military. We've gotten, unfortunately, a skill set around that. Thank God we had that skill set when we went through what we went through, because that same separation anxiety, that same issue of family not being able to go home. Again, in the documentary, you'll see lots of our team members went back to hotels or in housing that we supplied them. They didn't go home. But there's two heroes in my life that I'll tell you that I could not do what I did without them. It's my wife and my daughter, who I didn't see for several weeks in the beginning of it because of multiple exposures to the virus. Didn't want to bring it home. They supported me. They created a home environment that was supportive and there so that I could focus 100% on what I needed to do and the team needed to do. And that so reminds me of when you're deployed or when you're in the military and you're away from home, and that with having that strong family connection and having that support. But what we forget is what it did to them, and having a family member on the front lines and having that stress. So the organization, Jim, and you're aware of some of these programs we put together. Our support programs don't just span the employee, they span their families. Our military and veterans program is more about the families than it is about the veteran, because we know it really has to do with the family and the support structure, because they're the real victims in this. We get to go to work, turn it on, turn it off. They're in it. They're trying to manage what's going on. So those are my two heroes. I can never thank them enough for what they went through and the sacrifices that they put themselves through. And it's a story after story of what happened here. And I'm just one person of many who can say the same thing in the
Very
health system.
powerful, Jean. Thank you for sharing that with us. If I can ask you another question, Jean, how does your role with Northwell Health fit into your approach? And what kind of impact have you seen while supporting patient care and staff resiliency during these unimaginable times?
I'll tell you, my role is unique in healthcare. It's a new title in healthcare. You hear crisis continuity officer quite often in the for-profit sector. I go back to Mike Barger, the co-founder of JetBlue, wrote a book, High Stakes Leadership in Turbulent Times. It was a great book. I couldn't put it down. And in there, he talked about how we live in a VUCA world, VUCA world, volatile, uncertain, complex, ambiguous. But coming out of COVID, organizations like Northwell or other large health systems or even small hospitals, we have to be prepared. There are no longer an excuse of not being prepared, of not being aware of the unimaginable, of thinking about things that can be very destructive and disruptive to what we do, which is provide patient care. And I think COVID-19 did two things. It made an awareness that healthcare is truly part of the critical infrastructure of our communities. It is just as important as our fire department, police departments, sanitation, and other core elements that make your community work. Most often, healthcare is the largest employer in your community. Think about that for a minute. It drives the largest amount of revenue in your communities. It is the largest employer most time in the community. And it also provides the safety and is the area of last resort. So the requirement for us now, not from a community and government perspective, and you know this through the AHA, many new rules are coming out and legislative things, which we agree with. I think they're all the right thing to do. But how is an organization going to do this to the scale and size of Northwell? We're a $14 billion company. We have almost 80,000 associates spread out through over a population of over 15 million people that we serve. So preparedness was always part of our jobs, right? It was part of my job as a chief administrative officer. It was part of my job as a regional executive. But what this organization has done, and we have a history of doing this, and I give credit to Michael and our board and to Mark Salazzo, our chief operating, they think outside the box. And then I go back to what we did in 2002, and many of you know this, and I think it was highlighted. Dr. Kathleen Gallo was appointed the first chief learning officer of back then North Shore LIJ. She was the first chief learning officer in healthcare. And we took that out of JetBlue and other areas that were doing chief learning officers, and we created a corporate university. And what that did was, Michael knew focusing in on human capital was the first thing that he had to do as CEO. He had to invest and get the best people. To Jim, to your point, recruit the best. And how do you recruit the best? You give them career development, you develop them, and you give them the tools and you empower them. And people want that. They want to be communicated and empowered. And we created the first corporate university in this region. And when I look at that and where I look, it set a new standard in education and development in healthcare. Now, what I believe is we're again taking that chance in setting a new standard for preparedness now for large and for small integrated systems, where you have to have an individual in the C-suite, whatever that title might be or may not be, but an individual who's focused not just on risk management and all the things, but on the key areas that will really impact the operations of the business and creating plans, preparedness plans, training plans, and recovery plans so that the organization, when tested like a COVID-19, and again, we have other things like cyber and weather and all these things that are coming at us, there is no ability to fail, because when we fail, people die and there's no healthcare. And the stakes have never been higher. So our board and our CEO and our leadership have decided that this is important enough. And it not only was it a core tenant back in 2000, it needs to be a core tenant back in 2022. And I'm just so proud to be able to serve Northwell and our community in this role. And I'm hoping that we make a difference. I think when you talk about how this impacts our associates, how does my role or this focus impact our associates? That's a great question. When they come to work, they get out of their car, they get off the subway, and they're walking into the doors, and the doors open up. You want them to know we have their back, that we've thought about things during their shift, that we think about their safety, we think about their emotional and physical well-being while they're in there. We want our patients and visitors to feel the same way. And they expect now our employees expect organizations to be prepared. There's no longer an excuse. We don't have enough masks. We don't have this supply. We don't have that. It's expected now. And to do that, you need an organized C-suite level structure accompanied with many different modalities within the organization aligned around that one mission, and a person who's helping navigate that. And then lastly, with our teammates, we need to make sure they have a voice. And I know we're going to talk about this later as well, but they need to be part of the solution sets. They need to be heard. They most often have the best solutions to our problems. They need to be part of the preparedness structure. They need to be in the front lines talking about how it works. When do they need the help? What type of equipment do they need? How does that need to be activated? When do they need information? How do they want to be communicated to? You can't do that from 80,000 feet. Again, going back to that frontline leadership qualities that you talked about, you need to be present. You need to be arm in arm with your associates and your team members to hear them and see what they're seeing. And you only could do that by walking the halls, arm in arm with them, and understanding the decisions and the preparation that you're making. What are the outcomes of that? So I think when you do that, not only do you get buy-in as an organization, you get buy-in from your associates, and you create that openness that's needed and that voice that's needed, so that there's that complete top-down, bottom-up approach to communication so you can get the best outcomes.
So, a quick thought for you, that I was observing. You used a phrase recently with me that you talked about. Maybe one of the greatest challenges you have is the ability to imagine the unimaginable. And yet with that comes a burden of discernment, because there are some things you can share with others that should be a part of the decision-making process and understand the journey. And others, the fear factor, the paralyzation factor is a risk. So having that capacity for discernment in the environment in which you have to imagine the unimaginable and prepare for it. Talk to me a little bit about how you balance those two to create that fertile mind to be able to imagine the unimaginable, and yet the delicate touch it takes to keep your people safe.
Yeah, I don't know. Actually, the answer to that question, I think you have to be curious. I think you have to be somebody who's curious, somebody that can think outside the box. I often look at the outcomes of things that have happened in the past, and I go back and I look at what were some of the predictive indicators that we could have seen before something happened, and look at any major event within our country or internationally. You can always go back and take a look, and how come we didn't see that? How come it was so obvious? How come we didn't pick that up and then this event happened? So I think you have to be curious. I think you have to be well read and understood and understand how your organization operates. And again, Jim, I want to go back to, not everybody can do a position like this. You have to understand how your organization operates. You can't understand the threat unless you understand how the organization operates at all levels. Then you can do a threat assessment and understand, is this an impactful threat or not? And if you don't surround yourself with the subject matter experts and create that cadence of feedback, there is no way you're going to just, you could think of 100 things, but you have to scale them down to a workable level. So we focus on really 6 things that can take down the organization. Cyber is a big one right now. Everybody's talking about cybersecurity. Think about how fast health systems went from paper and pen to all electronic interventions. Everything from weight-based calculations in the dosages being given through the hospital to electronic medical records to the virtual medicines that we see today. We're very dependent on technology. I joke, I have a daughter who drives the car. It's got all the technology in it. We bought the safest car that we could buy. If I covered up that screen, she's going to kill me when she listens to this, but if I covered up that screen and I asked her to park the car by looking backwards and doing it the old-fashioned way, I think she would have a difficult time parking that car today because it doesn't have the bells and whistles and all the and not the way I used to park when I learned, right? While bumping the car behind us. But that's our generation, and we have to understand where those threats are, then bring that generation into the solution and not think that we know the answers. How can they operate now without it? So I think it takes curiosity. I think it takes understanding. And then lastly, I think it takes organizational commitment that the organization is going to make this one of the key aspects, fundamental aspects of the focus. It has to be. It doesn't bring in revenue quite often. It's not a new co within the company. It's not an expansion of ambulatory. It's an expense. It's an expense when applied can have a great reward. And I think COVID-19 showed if we didn't do some of the things that we did in the past to prepare, think about the financial and human capital impact if we didn't have that preparation mentality going into COVID. So that would be the areas, Jim, that really come to mind for that question. People are tired. They're tired of talking about crisis, right? So my biggest challenge right now is to get to everyone to think about what else might happen. So one of the things that is keeping me up at night is really technology disruption. It's not just cyber. Cyber is one aspect of it. But again, we've been so hyper-focused on becoming a technology company as well as a healthcare company that we've become very dependent on technology. And when that's exploited for either negative reasons or for interruption reasons that are beyond our control, we need to be able to do simple patient care. And I think those are the areas that we're looking to focus on right now. The issue that you have is you've had the longest running emergency in the history of the United States. And people are fatigued and they're tired of talking about the what ifs. And I think the biggest issue, Jim, I'm going to get back to culture, because this is where if the culture is coming from the board and from the C-suite and from the staff, if there's a culture of preparedness, people are going to get themselves back to the table and they're going to want to go forward. And I think, 9/11, when I went through 9/11 with the organization, the 9/12, how do we recover from this? And by 9/15 and 9/21 and 10/1 and 11/1, we were already moving forward, trying to recover, but also learning and not replicating different things that have happened. And what I can only hope is that same mentality, that same discipline, and that same sense of urgency will come back, that we start talking about those other things that are out there that are looming. COVID-19 is one virus of many other pandemics that sit out there. And Ebola came into the United States and it quickly came out. But there are a lot of other things that can threaten the organizational structure and its ability to operate.
Yeah, and I want to add a little bit to that. This was pre-COVID. Northwell and Michael Dowling, really tasked, I think, Joe with the mission of making Northwell a destination employer. What does that take across the board, organization-wide, from the bottom up or top down, all across the board for employee engagement, culture, retention, all of the things that matter the most? And I've been hearing this common theme, which is, in this entire podcast today, which is the value of voice, valuing the voice of all of the people in your organization, because it's the people that matter. It's the people that are creating what you're able to do in your communities. Can you speak a little bit to that and that preparedness that you all as an executive leadership team went through pre-COVID, doing all of this work to set yourselves apart, and how that helped you navigate all of this?
Thanks, Jamie, for that question. I think it comes down to one thing. We're a team environment. each part of us play a role. Each part of us respect each other's strengths, each other's weaknesses. And I think when you're in times of high stress, that relationship and that culture that has been predetermined before you walk into a room that's on fire, literally, there's great respect of each team member. And we're all willing to do one mission, that is to do the best job that we can. It's not about us. So it's about we. And I would tell you, if there's one characteristic that makes Northwell different, it's about we, and we're committed to public service. And I would say those were the two attributes, if you bring into the room, you're generally going to have a good outcome. So I appreciate the question.
Jean, Jim, and Jamie, thank you for joining us today and for sharing your insights and thoughts. If you'd like to learn more about the Hebets Company, please visit www.hebetsco.com. Thank you.